Okay, so you're getting ready for your LPN exam.
Big step.
It is a big step, yeah.
Huge.
And you know, one of the things that, like, really any good nurse, RN or LPN, has to have, like, a really solid grasp of is how food impacts patient health.
Absolutely.
So if you were studying for that LPN exam, this is for you.
This is the one.
This is going to be a deep dive into all those essentials.
For sure.
That will help you feel confident going into those exam questions.
Absolutely.
Specifically about, you know, the nutrition and food safety aspects of nursing.
Yeah. Yeah, what we're going to be talking about food safety. We're going to be talking about foodborne illnesses.
Right.
What causes them, how to prevent them.
Yes.
We're going to get into food allergies.
Yes.
And the ever so important food medication interactions.
Yes, that's like a cornerstone of providing safe and effective patient care.
It really is.
So we're going to break all that down.
We are.
And we are looking at some really solid materials that really highlight those fundamental principles of nutrition.
Yeah.
With a specific focus on food safety in the nursing world.
That's right.
So our mission here is to extract the absolute must-know information.
Yes.
To help you feel prepared for those exam questions.
Totally.
So let's unpack this.
Okay.
Let's get started.
Do it.
So the foundation, the bedrock of all of this is food safety.
Absolutely.
Food safety.
And as a future LPN, you're going to be in this key position of educating your patients and their families.
That's right.
About how to stay safe when it comes to their diet and their medications.
Yeah, you're going to be the one explaining how to do it.
Right.
And the ins and outs and how to stay safe.
Exactly.
You go, what to look out for, all of that.
So really, when we think about the big picture of food safety, it kind of boils down to a few really critical areas.
Okay.
First and foremost is preventing aspiration.
Right.
Second is really minimizing those risks of foodborne illnesses.
Yeah. And then third is being able to identify and understand food allergies. And then finally, being very, very aware of how food and medications can interact.
They can, sometimes in some very significant ways.
Right. Yeah. So let's tackle aspiration first, because, you know, that's an immediate and potentially really dangerous situation.
Absolutely. Yeah.
So the bottom line here is that food should only be given to somebody who is fully conscious and who has those protective reflexes intact. So we're talking about the gag reflex and the swallow reflex.
Exactly.
Those are there for a reason.
For sure.
To prevent food from going down the wrong pipe.
Absolutely.
So that's aspiration. And it's something to be very aware of.
So in terms of aspiration, it's super important to be aware of it with certain patient populations.
Yeah.
Like, for instance, someone recovering from a stroke may have impaired swallowing. Right. Or a patient who's just come out of anesthesia may not have fully regained those reflexes yet.
Yes.
So as a nurse, being, assessing their swallowing ability before they eat or drink anything is absolutely essential. Yeah. And it's also worth noting that young children, just developmentally, are at a higher risk of aspiration with certain types of foods. Right. So just something to always keep in the back of your mind as a future nurse.
So now let's talk about just food safety in general.
Okay.
Just day-to-day keeping food safe. This really boils down to three main things.
Okay.
How we store our food.
Yes.
How we handle it, and how we prepare it.
Absolutely. The 3 pillars of food safety.
Right. And if you get these right, you can prevent a lot of problems before they even start. So let's get into storage first, because temperature is a huge factor.
It's
in preventing the growth of harmful bacteria.
Absolutely.
So think about fresh meat: bacon, sausage, steaks, chops, roasts, even chicken and turkey. All of these things need to be kept in a refrigerator. That's 40 degrees Fahrenheit.
Yeah.
Or 4 degrees Celsius or colder.
That's right.
Now, once it's in the fridge, how long it lasts varies a little bit.
It does.
Bacon is generally good for about 7 days.
Okay.
Sausage, on the other hand, is only safe for about 1 to 2 days.
Gotcha.
Summer sausage has a much longer shelf life.
Okay.
If it's unopened.
Yeah.
We're talking like 3 months.
Wow.
But once you open it, you want to use it within 3 weeks.
Okay.
And then, steaks and roasts.
Yeah.
You've got like a 3 to 5 day window.
All right.
Chicken and turkey are similar to sausage. Use them within 1 to 2 days.
Gotcha.
So what about seafood?
Seafood.
Same rule applies in terms of temperature.
Yep. 40 degrees Fahrenheit or colder.
Yes, exactly.
Keep it nice and cold.
So lean, or fatty fish. You're going to want to use that within 1 to 2 days.
Okay.
Smoked fish lasts a little bit longer,
right,
like around 14 days.
Right.
Fresh shellfish, same thing as the lean or fatty fish,
okay,
1 to 2 days.
Gotcha.
And then canned fish is interesting because, in the pantry, it can last for quite a while,
right,
unopened. But once you open it,
it's
only good for like 3 to 4 days in the fridge.
So don't open that can until you're ready.
Right, exactly.
To eat that fish.
So let's talk about eggs.
Eggs.
A kitchen staple.
They are.
In the shell, in the fridge.
Yep.
They can last for 3 to 5 weeks.
3 to 5 weeks. That's great.
But hard-boiled eggs? Only a week?
Okay, so shorter shelf life once they're hard-boiled.
Right.
Right.
And then fruits and veggies.
Okay.
Anything that's perishable
right,
needs to be kept cold. Again, we're talking 40 degrees Fahrenheit.
So those pre-cut, pre-washed salads, all of that.
Yeah, all those convenient pre-cut.
Yeah, the pre-cut fruits.
And peeled options. Absolutely.
Gotcha.
Now, here's a point that I think sometimes gets overlooked.
Okay.
Perishable foods, in general, should not be left out at room temperature for more than 2 hours.
2 hours, that's the magic number.
Yeah, and if it's a hot day, I'm talking over 90 degrees Fahrenheit or 32 Celsius, that window actually shrinks to just 1 hour.
Wow, so it's really temperature dependent.
It is. It's kind of shocking how quickly bacteria can multiply.
It is a little scary.
In those conditions.
It is.
And also a quick tip about canned goods.
Okay.
Before you even think about opening them.
Yeah.
Take a good look at the can. Is there any rust?
Right.
Is there any crushing? Denting?
Yeah.
Is there any stickiness?
Yeah. Any sign of leakage?
Which could be a sign of a leak.
Yeah.
If you see any of those things.
Just toss it.
Toss it.
Yeah, better safe than...
No, better to be safe than sorry.
Absolutely.
All right, so we talked about storage.
Okay.
Let's get into handling.
Okay.
This is going to seem like common sense, but it is so important.
Yeah.
Wash your hands frequently. Wash them before you touch any food.
Every time.
Every single time.
And make sure your prep surfaces are clean, too.
Yes, all food prep surfaces need to be clean.
All of them.
And a key step to prevent cross-contamination,
right,
which is a major cause of foodborne illness, is keeping different types of food separate.
Okay.
Especially raw meats, poultry, and seafood away from foods that are ready to eat.
Right, like salads or things that are already cooked. You don't want to mix those.
And use separate cutting boards.
Yep. Different cutting board for your raw meat and your veggies.
Yes, separate cutting boards and utensils if possible.
Oh, sure.
All right, let's get into preparing food.
Okay, the final pillar.
The final pillar of food safety. Cooking food to the right internal temperature.
It's so important.
Is absolutely non-negotiable. When it comes to killing harmful bacteria.
Absolutely.
And there's also this step that I think sometimes gets missed.
Okay.
It's the resting period.
A resting period, what's that?
After the food has finished cooking.
Right.
You want to let it rest for 3 minutes.
Okay.
To allow that heat to distribute evenly throughout the food.
So it's not just on the surface.
Exactly.
Okay, so you're killing all the bacteria throughout.
That's right.
Gotcha.
So what are those target internal temperatures?
All right, the ones we have to memorize.
That we need to remember for the exam.
For sure.
For roasts and steaks.
All right.
You want to aim for 145 degrees Fahrenheit.
Okay.
Which is 63 degrees Celsius.
Gotcha.
Chicken needs to be a little hotter.
Right.
165 degrees Fahrenheit.
Okay.
Or 74 Celsius.
Gotcha.
Ground beef should be cooked to 160 degrees Fahrenheit.
Okay.
Or 71 Celsius. And anything that contains eggs.
Right.
So like, casseroles.
The quiche.
Scrambled eggs. Yeah. All of that also needs to reach 160.
160 for the day.
Or 71 Celsius.
Gotcha.
And then finally, let's just clarify something
that
you might see on packaging about the dates.
The dates. Oh, yeah, those can be confusing.
They can be so confusing.
Yeah.
So sell by date, that's more for the stores.
Right.
It's the last day they should have the product available for sale.
It's kind of for inventory purposes.
Right, exactly.
Gotcha.
Now, use by date,
okay,
that's more for the consumer.
Right.
It gives you an indication of when that product is going to be at its best quality.
It's when it's freshest.
Right.
Gotcha.
And then the expiration date.
Okay.
That is the final day that the manufacturer recommends you use the product.
So don't eat it after that.
It's not a good idea to eat things past their expiration date.
Yeah, it's just not worth the risk.
Because the quality and the safety can decline.
Exactly.
Okay, so we've covered the fundamentals of, how to handle and store food safely.
Yes.
But what happens when these guidelines aren't followed?
Right.
Even unintentionally. And that brings us to the topic of foodborne illnesses.
Foodborne illnesses, dun, dun, dun.
Right. No.
Not fun.
Not fun at all.
No.
So foodborne illnesses are usually the result of improper storage, inadequate handling, or insufficient preparation of food.
Yep, all those things we just talked about.
Exactly.
If you don't do those properly,
right,
that's when you run into trouble.
And as a future nurse, you're going to be playing a big role in primary prevention.
That's right.
Educating your patients and their families
about
how to avoid these illnesses in the first place.
Absolutely.
And these are simple things.
They are.
Like washing hands frequently, ensuring proper refrigeration, preventing cross-contamination, and cooking to the recommended temperatures.
Cooking it all the way through.
All of those things make a huge difference.
Absolutely.
Now, it's really important to understand who's most vulnerable to foodborne illnesses.
Right.
We're talking about young children, older adults, individuals with weakened immune systems, whether that's due to illness or medical treatments, and pregnant clients.
Yeah. All those folks are more vulnerable.
They're all at a higher risk of getting sick and potentially experiencing more severe complications from those foodborne pathogens.
It's just important to be extra careful with those folks.
It is.
Yeah.
And it's interesting to note that while viruses are the most common cause of foodborne illnesses, bacteria are actually responsible for the majority of the deaths.
Okay, interesting. So more people get sick from viruses, but more people die from the bacterial ones.
That's right.
Gotcha.
So what kinds of foods do we need to be thinking about that are most often linked to these foodborne illnesses?
Right.
I mean, raw or undercooked animal products come to mind.
Yeah, for sure.
Right.
That's a big one.
But it's also important to be aware that raw fruits and vegetables that have been contaminated with animal feces can also be a source of infection.
Yeah.
Raw sprouts, unpasteurized juices and milk, and even cooked foods that have been handled by somebody who's sick.
Yeah. So even if it's cooked, if someone who's sick handles it, it can still be a problem.
All of those can be sources of infection. So let's talk about some of the common bacteria.
Okay, the usual suspects
that are out there.
Yeah.
Salmonella.
Salmonella.
I'm sure you've heard of it.
Yes, that's one that everyone knows.
And it can be found.
It can be found in a lot of places.
In a lot of places. Yeah. Undercooked or raw meat.
Right.
Poultry, eggs, fish, and even on contaminated fruits and vegetables.
Okay, so even produce?
Yes. And dairy products.
No, wow, it's everywhere.
So symptoms can include...
Yeah, what does it feel like?
Headache.
Oh, no.
Fever, abdominal cramping. Diarrhea.
Yeah.
Nausea.
It's like the flu almost.
Yes.
Yeah.
Vomiting.
Yikes.
It's not something to take lightly.
No.
Because it could be fatal.
Really?
Especially in vulnerable individuals.
That's scary.
So that's Salmonella.
Okay.
And then, there's Escherichia coli.
Okay.
O157. H7.
O157, H7. That's a mouthful.
It is a mouthful.
Easier to just say E. coli.
It is easier to just say E. coli.
Yeah.
And this is often associated with...
It is often associated with raw or undercooked meat.
Yeah.
Especially ground beef.
Yes.
You got to cook those burgers all the way through.
You do.
Yeah.
So it can cause severe abdominal pain.
Yeah, it's no joke.
And often bloody diarrhea.
That doesn't sound good.
It doesn't sound good, no.
No.
And in some cases, it can lead to a very serious condition called hemolytic uremic syndrome.
Hemolytic uremic syndrome, okay.
Which involves severe anemia.
So that's a blood problem.
It is a blood problem and kidney failure.
Wow. So that's
very serious.
Severe.
That is very serious.
Yeah.
Another bacteria to be aware of is Listeria monocytogenes.
Listeria monocytogenes.
And this can lurk in a lot of places.
Where does it hide?
Soft cheeses.
Oh, okay.
Raw milk. Undercooked poultry.
So, like chicken that isn't cooked all the way through.
Right. Processed meats.
Processed meats, like what?
So, hot dogs.
Okay.
Deli meats. And even raw vegetables.
Wow, so it's in a lot of different places.
It is in a lot of different places.
Okay.
Now, Listeria is particularly a risk for newborns, pregnant individuals, and people with weakened immune systems.
Right, so those same folks we were talking about before.
Exactly.
Gotcha.
Symptoms can include...
What does it feel like?
Sudden fever.
Oh, no.
Diarrhea.
Uh-oh.
headache.
That's familiar.
Back pain, and abdominal discomfort.
Yeah, so a lot like the other ones.
It can be very similar.
Okay.
And for pregnant individuals, Listeria infection can lead to stillbirth.
Oh, no.
Or miscarriage.
That's awful.
It's very serious.
Wow. Okay.
So that's on the bacteria side.
Okay.
Let's switch over to the viral side.
Okay.
Norovirus.
Norovirus.
This is a major player in foodborne illness.
It is. It's very common.
And it's incredibly contagious.
It is.
And can spread very easily.
Yeah, it spreads like wildfire.
It does.
Yeah.
Through contaminated fruits and vegetables.
Right.
Salads.
Yeah.
Prepared by someone who's infected.
Mm-hmm.
Raw oysters.
Okay.
And even contaminated water.
Wow. So a lot of different ways to get it.
And a lot of different ways to get it.
Yeah.
Now, the onset is usually fairly rapid.
Okay.
We're talking 24 to 48 hours after exposure.
So pretty quick.
Yeah.
Okay.
And the symptoms are pretty unpleasant.
What are they?
Projectile vomiting.
Oh.
Fever.
Okay.
Muscle aches. Watery diarrhea.
That sounds familiar.
And headache.
Yeah. So again, kind of flu-like symptoms.
Very much so.
Okay.
So, all of this just highlights how important those food safety guidelines that I talked about earlier are.
You got to follow them.
You do.
Yeah.
Okay, now let's move on to food allergies.
Food allergies. Okay.
Right.
So different from the foodborne illnesses.
Yes. This is a different kind of reaction.
Okay.
So when you're doing a nutritional assessment for a patient, identifying any existing food allergies is really key.
Yeah. You want to make sure you know what they're allergic to.
You do.
Yeah.
And it's important to understand the difference between a true food allergy and a food intolerance.
Right, because they're not the same thing.
They are not the same thing.
Okay.
So a food allergy is a consistent and often immediate reaction that happens every time someone's exposed to a particular food.
So like every time they eat peanuts, they have a reaction.
Okay. And it involves the body's immune system and the release of substances like serotonin and histamine. Right. Now, food intolerances are typically...
Food intolerances they're a little different.
Yeah, they're different.
Yeah.
They're less consistent.
Okay.
And they're often dose-dependent.
Dose-dependent,
meaning that a small amount of the food might not cause a reaction.
Okay.
But a larger amount will.
So it depends on how much they eat.
Right.
Okay.
And importantly, they don't involve the same kind of immune system response as a true allergy.
So it's not an allergic reaction.
It's not a true allergic reaction.
Okay.
A good example is lactose intolerance.
Right. Like some people can have a little bit of milk and be fine. But if they have too much, then they have a reaction.
They have a reaction.
Okay.
So in adults, there are 8 major food allergens that account for the vast majority of reactions.
So these are the ones to really watch out for?
Yes.
Okay.
Milk, peanuts, fish,
eggs,
soy, shellfish, tree
nuts,
and wheat.
Wheat.
Now, some infants who show allergic reactions to cow's milk or soy often outgrow those sensitivities by the time they're 4.
So they might be allergic as a baby, but then they grow out of it.
Exactly.
Okay, that's good to know.
So the signs and symptoms of a food allergy can range from pretty mild to very severe.
Okay.
So, you might see nausea, vomiting, diarrhea, abdominal bloating.
Okay.
And
so some digestive issues.
Yes.
Gotcha.
But it's really important to remember that some allergic reactions can be extremely severe.
Okay.
And even life-threatening.
Oh, wow.
Leading to anaphylaxis.
Anaphylaxis, that's serious.
Which requires immediate medical attention.
Right. Call 911.
Yes.
Yeah.
So let's talk about food-medication interactions.
Okay, this is a big one.
This is a big one.
Yeah.
So it's really fascinating how what we eat and even the timing of when we eat can impact how our medications work in our body.
Absolutely. It's all connected.
So food can affect the way a medication is absorbed from the digestive system into the bloodstream.
Right. So it can affect how much of the drug actually gets into your system.
Exactly.
Okay.
So taking a medication with food can sometimes increase its absorption.
Okay.
And that, in some cases, can lead to improved peak effects of the drug.
So it works better if you take it with food. Okay.
But food can also decrease the absorption of a medication.
Right. So it might not work as well.
Right. It might delay how quickly it starts working or even reduce its overall intended effect.
Okay. So it's important to know which is which.
It is very important.
Yeah.
And some medications can be irritating to the lining of the stomach.
Yeah, they can upset your stomach.
They can.
Yeah.
And that's why certain drugs like ibuprofen, some forms of amoxicillin, and some antidepressants like bupropion are often recommended to be taken with food.
Okay, so it helps to protect your stomach.
Exactly.
Gotcha.
Now, it's not just absorption that food can affect.
Right.
Sometimes certain foods can interfere with how the body metabolizes medications or break them down.
Right.
Or they can have direct effects on the medication's actions.
So the food can actually change how the drug works.
Yes.
Okay.
Grapefruit juice is a really good example of this.
Grapefruit juice, everyone always talks about that.
I know, it comes up a lot. Expert.